So between this new treatment and elementary age kids now being able to get this COVID vaccine, it's been a very big week in the fight to end this pandemic. I want to bring in Dr. John Brownstein, epidemiologist from Boston Children's Hospital. It is good to see you. Dr. Brownstein, so this initial vaccine rollout for adults was chaotic, it was confusing. So what are your thoughts so far on the rollout for kids 5 to 11?
Well, hi, Sonia. I think that we're going to see a slightly different rollout. Of course, we've learned a lot in the past year, but in some ways, this is a new vaccine. It's different dosing, different needles, different vials, different cold storage. So some things have to start over again. And that's why, we've seen a little bit of a delay from the FDA and CDC to actually getting shots in arms. But it's going to happen. And, there are 15 million doses that are being deployed in pediatrician offices, family doctors, pharmacies. There's plenty of supply that will be coming in the next week. So I think, obviously there's a lot of anxiety, but there is plenty of doses. In fact, HHS ordered 65 million Pfizer pediatric doses. So that covers the entire 28 million children that are eligible for the vaccine right now. So everyone should have access, lots of options. It's just going to take a week for things to really get into full swing.
Yeah, and that is exactly what I've heard from pediatricians here locally. So 63% of parents are hesitant, and they're sort of still in this place where they're debating whether or not they want their kids to take this shot, especially since the vaccine trials were far smaller than those for older age groups. 3,000 kids we're talking about. So are you confident that the trials were sufficient? And what do you say then to those parents who are actually hesitant?
No, listen, I think we have to, have conversations and listen to one another. I have a 10-year-old. She just got her first shot this morning, so I'm quite excited. She was over the moon. And I did this because I recognize that the data that we have is based on rigorous analysis, and we set the bar incredibly high for our kids. All the data was compelling. The safety profiles were amazing. FDA, CDC, there were all these guardrails in play, and the side effects were really mild and short-lived. So there's a recognition that this is an incredibly safe but also effective vaccine that could prevent tens of thousands of hospitalizations in our kids. And so, this is a vaccine that is probably the most studied vaccine ever produced. And again, we've already had 15 million older kids get this vaccine with really no issues. So I'm highly confident, but of course, everyone should have the conversations with their pediatricians and get all the information they need.
So, Dr. Brownstein, I want to talk about side effects because I think this is where some parents get tripped up. I listened in, as you know, on that ACIP meeting earlier this week and heard the data that was shared. The most common side effects for kids who received this shot: fatigue, headache, and pain at the injection site. But I'm hearing a lot of nervousness around two things specifically: myocarditis and fertility. So can you kind of clear this up for us? Is the vaccine linked to either?
Yeah. So, okay. Yes. So we've seen the mild side effects, as you mentioned, pain at injection site, fatigue, headache. And that's about it that we saw in these trials. No serious adverse events were identified. That includes myocarditis or anaphylaxis. There is a potential concern of a connection to myocarditis, which was seen in older kids, boys. That is shown to have had a small impact, nothing near the impact of COVID itself in myocarditis. So if you think about the cost benefit, the benefit of the vaccine would prevent any real complications with myocarditis with the virus itself. With fertility, there's really no data to support any adverse events whatsoever. These, again, are such studied vaccines. The processes that they have put in place to monitor this vaccine are beyond anything that we've ever seen. And again, nothing that is associated with fertility. Again, we may see risk around myocarditis unfold as we broaden, the numbers of kids that get this injection. But so far, risk is incredibly low, especially as you think about the massive benefit of this vaccine.
Yeah, and what the data showed, as far as I know, is that it sort of corrected itself. I want to talk about flu because it's flu season as well. So can kids get the flu vaccine and the COVID vaccine at the same time?
Yeah, I know there's a lot of confusion about this one. Initially, they suggested waiting because we just were looking to understand the impact of having the COVID vaccine in the population. Right now, we recognize they can get both. Both my kids get both at the same time. It's totally fine and recommended. And it's just important that everyone gets immunized for both because of the fact that we're worried about these twin demics, bad flu season plus a surge in COVID.
Do you have any thoughts, Dr. Brownstein, on these therapeutics that we're hearing about, first Merck, now Pfizer, promising and impactful?
I think both. Very exciting data. It's kind of funny because in some ways you'd expect therapeutics to come, then vaccines. We have these vaccines that are incredibly effective, and I don't want these therapeutics to take away from the potential value of these vaccines. The first sort of line of defense is the vaccine, And then, of course, breakthrough, if that happens, these treatments are really exciting and important and can be a part of the end of this pandemic. But, of course, you don't want to be in a position where you're infected and dealing with symptoms that potentially could result in long COVID. So still the important, primary vaccination is critical, but it's great to have these additional weapons in the fight against this pandemic.
And real quickly, boosters. I think a lot of people now are going, do I need one now? Should I get one? Should I mix and match? Does it matter? What's your guidance on that?
Right. I think that what we're going to see over time is more and more people will get the booster. And in fact, most people who got vaccinated are eligible for boosters just based on underlying chronic conditions and timing. Everyone that got the J&J vaccine should go out and get a booster, probably an mRNA vaccine, which we've seen likely produces better immune response. If you had one of the mRNA vaccines, it really doesn't matter. What we've seen is the data isn't that clear on which one to get. There's a recommendation to just stick with the one you originally had just because you have an experience with it. I actually was Moderna and then got Pfizer. So I think it's really what is available and most important just to get the shot if you're eligible for it and not worry too much about which brand is available at the time.
Okay. Dr. John Brownstein, thanks so much for your time today. Really appreciate it.
Thanks, Sonia.